Hello and welcome to this webinar. I'm Emma Green, I'm the tennis elbow queen. I'm going to share a little bit more about myself as we move through. There is going to be time at the end for questions. And yeah, let's get started. So I wanted to put this together today because things in medical research change really quickly. And I wanted to share with you as much new information as is out there. So that's what we're going to go through today. There's going to be stuff in here that will be new to you. And as I say, if you have questions, please pop them into the Q&A because I will answer all of them at the end. I am going to be asking you guys some questions as we go through as well. If you put the answers to the questions I'm asking you as we go through into the chat, that would be amazing. And just keep the Q&A for questions. That would be great. Thank you so much. And okay. So by the end of this webinar, you are going to know why things you've tried haven't worked. And honestly, you are going to be surprised by some of the information I'm going to be giving you. But you are also going to learn some of the newest, it's all research backed, so it's evidence-based. So there is scientific research behind it, and I'll explain that to you as well. You're going to learn the things that you should be doing moving forwards. And so you are going to leave this webinar with some actionable steps that you absolutely can start today to start feeling better. So let's start by saying, well, what is tennis elbow? Tennis elbow affects the tendon on the outside of the elbow. So if you feel on the outside of your elbow right now, that bony point, the tendon attaches to that bony point and it's about 1 centimeter long. So it's not a very big structure, but it's just if you go slightly down your forearm, that is where the tendon is. It's just in front of that bump. So in tennis elbow, or if you're suffering from tennis elbow, it is common to feel the bony bump, feel pain at the bony bump. You can also feel pain just in front of that bony bump. That's where the tendon is. You can also feel pain into the forearm muscles. So that's another common area that pain will affect. And then also a little bit kind of up and behind the bony point, a little bit higher on the bone there. Any of those 4 spots, that's still tennis elbow. It still corresponds with tennis elbow. Well, what is a tendon? A tendon is basically a connective tissue. It attaches the muscles to the bone. So the muscles of the forearm, which basically when they switch on and work, they lift the wrist and the fingers up, they attach to that bony point on the outside of the elbow. In tennis elbow, it's the tendon that is affected. So just to give like a little bit of an anatomy lesson on tendon, if we were to scan a normal tendon, so a tendon that's not affected with tennis elbow, they kind of look like a rope. If you were to actually physically see it, normal tendons are white and shiny. They kind of glisten. If we looked at it on imaging, say an MRI or an ultrasound scan, normal tendons look like a rope. They're very tightly packed together. The fibers are all very uniform, and they're all kind of, packed together. It kind of almost looks like stripes. In a tendon that has tennis elbow, imagine somebody's got hold of a rope and twisted it the wrong way. So the fibers start splaying out, they start coming apart. That causes thickening. So you can actually feel a thickening in the tendon. So the fibers start coming apart, cells get in there that shouldn't be there. And if you actually physically were to look at a tendon that has tennis elbow, they don't look white, shiny, and glistening. They look sort of a gray-brown color and just an unhappy tendon. They don't glisten anymore. It's a degenerated tendon. It's a tendon that's not happy. Now, I said that word degenerated. It's nothing to do with age. It's all to do with overuse and the pathology. So we'll touch on that a little bit as we move forwards as well. So I wanted to introduce you to Buddy. Buddy, he describes himself as my patient zero, and he absolutely was. So Buddy is a professional drummer. He is currently, he's on hiatus right now from a world tour. So he is back drumming. They've just completed the North American phase of the world tour, and they'll be heading out to Europe next. So, I mean, it's just so amazing to see him. But Buddy entered my world 16 years ago, and he, professional drummer, had tennis elbow for 18 months. Couldn't drum, couldn't play, couldn't, pick up his bottle of water, as he describes it. And he tried everything, as you can imagine. For a professional drummer to not be able to play, that's obviously devastating. He's not able to support his family. So he ended up in front of me 16 years ago, and I was asked to see him. And when I say he tried everything, he'd had physical therapy, he'd had occupational therapy, he'd tried massage, he'd had acupuncture, he'd had every injection under the sun. I mean, he had tried everything. He was considering having an X tattooed on his arm for where it hurt, because he was just having so many shots into it, and nothing worked. So he ended up in front of a surgeon, and the surgeon, he said to the surgeon, like, surgery, I need this sorting out. And the surgeon said, no, I know you've had therapy, but you've not seen my therapists. Sent him to the hospital that I just happened to be working at the time. And he saw one of my co-workers, who is an amazing certified hand therapist. And she had worked with him for a little bit of time, and he wasn't really responding normally as most people do. And so she just asked me about him one evening. She's like, I've got this patient, I don't really know what's going on. What do you think? And I said, you know what, put him on my list. He was starting to ask her sort of unusual questions, like, can my thoracic spine affect my elbow? And so your thoracic spine is basically your mid-back, kind of in between your shoulder blades, kind of where your rib cage is. And she was like, I have no idea. She's a certified hand therapist. So they basically deal with shoulder, elbow, wrist, and hand. Yes, certainly some neck issues, but as it starts to progress down, that's not really their area of expertise. So I said, you know what, put him on my list. I love a challenge. So I saw him. I can vividly remember the first day he came into me. He just looked so dejected. He was standing in the waiting room, kind of leaning against the wall and just looking down, not really making eye contact with anybody. And I can remember as I called his name to, like, it's like, come on in, let's get this going. He like literally rolled his eyes at me. I think he was just like, here's another person who's gonna delay what I need getting done, because he at the time was like, I just need surgery, and somebody else who's just not going to be able to help me. And as I said, I like a challenge, and I was like, no, I'm going to help this dude. I'm going to figure this out. So I, at the time, was very, very lucky that I was able to dive into the research. I had time baked into my schedule at the hospital that I worked at to be able to do research. Just thankfully happened to be at that time. Had I met him 5 years later, I would not have had that luxury. So at the time, I dove into the research 16 years ago, figuring out, how do I heal tennis elbow? What do I need to do for this? And what I found was that there was very little that was shown to be beneficial for tennis elbow. There was a lot that was not helpful, but there was very little that was. And I was like, okay, that's not good. What am I going to do? So I tapped into my sports background. So previously, like the first decade of my career, I was a sports physical therapist. I used to travel around with sports teams. And so I got very used to treating tendon injuries and getting them back fast. Not particularly tennis elbow, because at the time, most of the athletes I was seeing were field hockey players, soccer players, those types of injuries. It was predominantly lower limb, but I knew I could get tennis elbows fast really quickly. So I thought, well, what if I take those principles and apply it to the elbow? Let's see this. And it worked. So Buddy got better. Obviously, like I say, he's on his world tour now, playing drums. He went back to the surgeon 6 months later and was kind of like, happy Buddy. And so the surgeon called me up and said, what did you do? Well, I just applied these principles and ta-da, it worked. So since then, I've basically just been seeing tennis elbow patients for the last 16 years. So it's allowed me to dive really deeply into this one pathology and really get a good understanding of it. Because if you've had tennis elbow for any length of time, you know that a lot of people don't really understand it very deeply, because it's not as common. I say not as common. About 2 to 3% of the general population are going to suffer with tennis elbow at some point in their lives. It's about 50% of tennis players. So if you're a tennis player, absolutely, it is very common. But it's not as common as back pain, which, research will tell us about 80% of people will suffer with back pain. If you have never suffered with back pain, please put a me in the chat. I'd just be astounded if anybody does, because I think everybody has at some point. So most therapists, most doctors, most primary care physicians, they get really good at treating the things they see, which is back pain, neck pain, knees, shoulders, elbows, not so much. So it can be very frustrating when you just, you're hitting your head against the wall every time. So this is how I became the tennis elbow queen, but basically by meeting Buddy. And so sports was my background. So I have a master's degree in sports injury and therapy. I did train in the UK and worked there for over a decade before coming out to the US. I now live and work in California. So I am a licensed physical therapist in California, but I treat and work with people all over the world. I work with people virtually. Every single person I work with now virtually. I don't see anybody in person. And the reason for that is when COVID hit, we had to shift. I used to have a clinic, and when COVID happened, we shifted everybody to be online. But I already knew that worked because I was already working with people in Europe and India and Egypt and Australia and all over the place. So I knew the outcomes were the same as if I was seeing people in person. And it just allows me to help more people. But I also use different elements. I don't just do physical therapy. I use empowered relief, which is a pain psychology treatment that was developed at Stanford University. So I integrate that as part of what I do. And I'll come on to why that's important as well as we go through. I am also a clinical Pilates instructor. So I use elements of that because often we see that a weakness in the core or a weakness around the shoulder blade can lead to these issues. So we don't just look at the elbow, we look at everything holistically. I'm also a certified high performance coach. I work with a lot of high performers. And so I integrate elements of that psychology into what I do as well to achieve fast results. I am a published author. I have 2 books. Tennis elbow relief, as you can see there, was being admitted into the World Tennis Library at Wimbledon. It was an amazing day. It was so fun. I got to go and put the 2nd edition in there now. I'm going to be doing that the beginning of next month, which will be super exciting. And then Get Out of Pain Fast, which is a more holistic book. But it just, each time I've done these, it allows me to dive into the research deeper. And this is something that is so important because new research is coming out all the time. A lot of what I'm going to share with you today is based from research that came out in March of this year, the end of March this year. So this is like real cutting edge stuff. And unfortunately, what you find is that it takes a really long time for medical research to percolate down into medical practice. So some of the things I'm going to share with you is very, very new. Some of the things I'm going to share with you, we've actually known for a very long time, but it's not necessarily common practice. So I love diving into the research. I am a total research nerd and I love learning about this stuff. So when, 16 years ago when I was working with Buddy, dove into the research, I was able to dig deep into it then. Then when I created my online program 5 years ago, did again, dive into the research. What are the most important elements? We cut out all the fluff. We just do the most important things that move the needle. So everything I teach is evidence-based, which means there is scientific evidence to show why it works, how it works, what it does. And I explain that to my clients as well, because I want them to know why we're doing certain things, because some of the things I advocate are very different to other people. And I want you to know why. Why is she telling me to do this? Sounds really weird. Well, I tell you why. What effects are we trying to achieve with each single thing? And so it's really important to I want to keep up to date with the research. So 5 years ago when I created the program, I did it. Then 4 years ago when I wrote the first book, I did it. And then 3 years ago when the second book came out, dove into the research again. The 2nd edition of the book came out last year, dove in again. And then for this webinar, you guys allowed me to dive into the research again. So I'm going to share what I have found that, again, that is updating my knowledge and therefore my practice. So thank you for that. I appreciate it. So, okay, I want to know what stage of healing are you in? And I want you to put a number in the chat. So is it number 1, acute, number 2, subacute, and number 3, chronic? So I'm going to go through these so that you understand what each one means. So acute is the inflammatory phase. This is if you've been feeling pain for the first 3 weeks. So if it's only been 3 weeks, you are in the acute phase. So you would be a number 1. So pop a number 1 into the chat if that is you. So this is when the injury is very fresh. It's very new. There's a lot of things going on, and this is why we need to know what phase you're in, because in this early fresh stage, there's a lot of bleeding and inflammation, because the body is trying to send cells to the area that are going to start the healing process off. So there are certain strategies, certain treatments that work really well in this particular phase, but if you did them in a later phase, it's going to make you worse, and the other way around. So it's really important to know. So if you're in the acute phase, pop a number 1 in. Subacute, that takes us between 3 weeks and 3 months. So if you've been feeling this for less than 3 months, but more than 3 weeks, you're in that subacute phase, you're in number 2. This is when the body starts to try and heal itself. So it starts laying down new tissue to try and heal that tendon. We have a decrease in inflammation. There's a really big drop off in the inflammatory cells that we see in the area during this phase. And so the body is just really focused on laying down that new tissue. So if you are within 3 weeks and 3 months, you're a number 2, pop that into the chat. Number 3 is chronic, basically 3 months onwards. So if you are a number 3, if you have had this for longer than 3 months, pop a number 3 into the chat. This is most people that I see. I do see, because the surgeon still sends me the tennis elbow clients, I do see some people who are less than 3 months. It's much easier to resolve it in that stage. And again, it comes down to this. It comes down to, well, what is happening in the tissues? What is happening in the body when we are getting sort of beyond that point? So when we're in the chronic phase, this is remodeling. This is where the body, the healing process is continuing. So the healing process doesn't finish. It continues on, but it just kind of changes. So there's no inflammation at this point, or very few inflammatory cells there. And this is quite a lengthy process in tendons. And the reason for that is they don't have a good blood supply, so they really struggle to heal. So it really kind of slows them down. So let me know, are you a 1, a 2, or a 3? So, oh, I'm sorry. I'm hoping that you can hear me okay. Hope you can hear me okay. I didn't even ask that. I hope you can hear me. 1, 2, or 3. Okay, so we've got some 3s, got some 2s. As I say, most people I see are chronic. Most people are, sorry about that, most people are chronic. And so, as I said, it matters because using the wrong techniques at the wrong time can and will delay your healing. So it's important to know, and you'll see this as we go on to the new research that's coming out. You'll see why this is so important. So let's dive in. Okay, ibuprofen can make you worse. And this is, very new research. Obviously, I'm sure if you've used ibuprofen, if you've tried ibuprofen, please put a me in the chat. I would guess most people who end up in front of me have tried ibuprofen. The thinking is there's inflammation. I need to decrease the inflammation. That's what ibuprofen does. So I'm going to take that. And absolutely, that was our thinking. So new research coming out actually shows that it can, as you can read here, decrease the tendon cell growth. It can inhibit the production of the extracellular lattice components. That basically means that when the tissues is trying to stick itself back together. And it can promote the presence of damaging enzymes. I mean, Not good, right? So it can increase the risk of tendon problems when you're using this for an overuse injury. If your overuse injury is a tendon problem, this is not a good thing to do. However, the one caveat is if you are in that acute phase, that 0 to 3 weeks, that would be the time window to use ibuprofen. Beyond then, it's not going to be helpful. In fact, now we know it's going to be detrimental. So if you're using ibuprofen, we got to stop that. We want to stop. Yeah. That's great. Good, good, good. Okay. All right. Moving on. Cortisone injections will make it worse. This is one of the things that we have known for a long, long time. Now, if you've had one, do not beat yourself up. If you haven't had one, don't have one. If you've had one, don't have another one. Cortisone steroid injections. So if we go back to the 50s, this is when they kind of first learned about cortisone. Cortisone is a very strong anti-inflammatory. So the thinking behind it is, let's put a very strong anti-inflammatory right into the area that's needed, and that is going to help to decrease the inflammation, boost up healing. It's going to be beneficial. And initially, when they first started doing it, and they would do this for a lot of athletes back in the 50s. So think of the football players, they would inject them every week before they sent them out to play. And it worked really well, brought inflammation down, made them feel good. They would be putting obviously some local anesthetic in there too, and they'd be able to go play every week. And so they were like, oh, this is great. However, a few years later, those football players basically started to fall apart, like literally fall apart. And what the research found was that steroid injected into a tissue is actually, it weakens that tissue, it softens it, weakens it, and can predispose it to rupture. So we've known that for a long, long time. However, steroid injections are still given for tennis elbow and are still offered very frequently for tendon issues. Well, why is that done if we've known for a long time that it can be detrimental? The problem is, again, when research comes out, it takes a long, long time to percolate down. A lot of medicine. So I used to work with a lot of orthopedic doctors back in the UK. I'd be in clinic with them, and they would have a team. So you have the consultant, who's sort of the main guy, the surgeon. Then you would have a registrar. Then you would have a senior house officer. Then you would have a junior house officer. So they're all part of the same team, but they're just at different stages in their career. And so it's the consultant or the surgeon's job to train the registrar. The registrar is going to train the senior house officer. The senior house officer is going to train the house officer. So that's kind of how it worked. And so the thinking back then was they're going to see one, do one, teach one. So they watch a steroid injection, they would do a steroid injection, then they would teach a steroid injection to the next person down the line. And so that's how this perpetuates. It's like, well, this is what's done for this, teach it to the next person. When new research comes out, it isn't always disseminated out. You can imagine the drug companies don't want this information out there because then they're going to sell less of their drugs. So it can be challenging to get this information out there. It can be challenging to know, how up to date is the practitioner that you're working with regards to this particular thing. And if it's not their main thing, it can be really challenging for them to stay up to date with everything. Nobody can stay up to date with everything. So steroids are not good for tendons. The other thing about this, when there's been so much research done on this over the past few years, we know that certain physical therapy elements can be very beneficial to tendons, and we can see that improvement. If you then add a steroid injection into that mix as well, it negates the positive effects of the physical therapy. So having a steroid injection can lead to worse outcomes. It can lead to prolonging the issue. So as I say, if you've had one, don't beat yourself up. Just move forward. You definitely can still heal. If you've not had one, don't have one. Local anesthetics are toxic to tendon cells. So again, I just said, when they put basically they make a mix. And I used to do injections back in the UK as a physical therapist. I was an extended scope practitioner. So I would do certain steroid, I was trained to do certain injections. And so we mix the steroid, and I'm doing it like this because this is how you mix it. The steroid and the local anesthetic we would mix together and inject that as a mixture, because the local anesthetic is going to make you feel better. It's going to give you less pain. But now we know that local anesthetics are toxic to tendon cells. So obviously we don't want those injected into a tendon if it's toxic to those cells. So for the longest time, we just thought it was the steroid component. Now we know the local anesthetic has a component as well. But hey, even if we take steroid injections out of the mix, maybe we put PRP in there, or stem cell, or enzymes, or vitamins, or anything else I've heard like people have injected into their elbows to try and resolve it. They're always going to add some local anesthetic because that makes you feel better. But the local anesthetic is toxic to tendon cells. Certain antibiotics can cause tendon issues. Again, we've known this for a while. It's often if we are talking to somebody and we're looking for a cause. It's like, what cause this? Maybe they don't play tennis. Maybe they've not increased their gym. Maybe they don't sit at a desk all day. What is it? And it's like, oh, I had that chest infection 6 months ago and I had the antibiotics for that. So there are certain antibiotics that can cause tendon issues. And we know this. We know this particularly, it was initially found in Achilles tendon problems and could potentially lead to tendon ruptures. I have seen this in a handful of patients. Now, I've worked with over 4,000 people who've had tennis elbow, and I can probably count on one hand the number that have the number that it was caused by antibiotics. So it is a very small number, but it can have very serious consequences. So, for example, if you are an athlete and you have a chest infection, you're given these types of antibiotics, you need to decrease your training because of the effect that the antibiotics can have on your tendons. So again, having this knowledge and knowing what to do if you are, you have to have these antibiotics for whatever reason, it's really important to put that in place because it can lead to tendon ruptures. Okay, complications of tendon injuries. I know it all sounds a bit doom and gloom, but I'm going to turn it around, I promise. The biggest things that I see with tennis elbow are weakening of the muscles. That happens incredibly quickly. So weakening of the forearm muscles, weakening of grip strength, that's something that we need to regain. That happens very, very fast. And then obviously the loss of function and the loss of being able to do the things that you want to do. Okay, so tendons are very slow to heal. Again, if we go back 16 years ago when I first started working with Buddy, back then, 16 years ago, we thought tendons healed in 12 weeks. That was the medical knowledge at the time. And that's what I found when I was doing all of my research. Tendons heal in 12 weeks. So 12 weeks, we would set a protocol for 12 weeks. Your tendon is going to heal in that length of time. Then probably 12 years ago now, a piece of research came out that said, no, tendons do not heal in 12 weeks. They heal in 12 months. And so that kind of obviously shifts the timeline. And this research came out as imaging improved, and we could see on imaging this progression of healing of tendons, and saw that it didn't stop at 12 weeks, it continued on. So there's another piece of research came out probably 5 years ago, maybe 8 years ago, in between, that shows that actually tendon injuries it can be anywhere from 12 to 24 months for them to heal. Now, that doesn't mean to say you're going to be feeling pain for that length of time. You're absolutely not. We want to do the right things at the right time, going back to the different phases, to get the healing process that we want. If you don't do the right things, if you just sat back for 12 months and didn't do anything, the tendon's not going to heal. And the reason for that is tendons like load, they like strain, they work when the muscles work, so they like loading. So if we don't load a tendon, it doesn't heal. So it's not just that, oh, in 12 months my tendon will be better. It's in 12 months of doing the right things, my tendon will be better. So that's the important point there. So the key to effective treatment is we've got to know what the cause is. We've got to know what is the underlying pathology. For most people, it's going to be overuse. For most people, and this is the question that I ask people. So I want you to think about this now. If you think about when you first started feeling the pain, what changed 3 to 6 months before you started feeling the pain? Did you start playing tennis? Did you increase playing pickleball? The number of people I say who retire and then start playing pickleball every day. It's amazing. I mean, I love that they're being active and they're playing. That's phenomenal. But they could have done with a little slower progression to get up to 7 days a week, but they just love it. It might be that you renovated your house. It might be that you were traveling and lifting heavy suitcases. There are so many different causes. It might be that you increase your weights in the gym, or you added a new exercise, or all of these different things can cause the overuse issue that triggers tennis elbow. It can be caused by a slip, bump, trip or fall. A bump to the tendon can trigger the pathology. It can trigger tennis elbow. Again, it's less common, but it can happen. For some reason, that seems to happen a lot to chefs. They seem to bang their elbows on the fridge door or the door frame or something. And I don't know why, but I've seen a lot of chefs that has been their triggering incident. But it's really important to look at everything, because once we go beyond 3 months as well, that get into the chronic phase, what we tend to see is that other things are affected as well. And other things that can be affected are other tendons. So it might be that someone's feeling it on the outside, well, now they're feeling it on the inside, golfer's elbow side, or maybe they're feeling the shoulder, or maybe they're feeling the wrist or hand. That can happen. It can be that nerves start to be involved. And the reason for that is the tendon on the outside of your elbow, on that bony point, is very close to the nerve. If you just dip down into that little groove, if you've ever hit that, that's your funny bone, there's a nerve that sits in there. So they're very, very close anatomically. When you get tennis elbow in that tendon, it thickens it, and it obviously then takes up more space. That can irritate the nerve, and then we can start getting nerve issues also. So it's very important to know exactly what is causing this. If we start getting the nerve issues, if we start getting beyond 3 months and we start stepping into chronic pain, so basically chronic just means more than 3 months. Pain, you've been feeling pain for more than 3 months. That's what chronic pain is. And what we know is chronic pain can change our brain. It can change the biochemistry in our brain. It can change the anatomy in our brain. And if that is not resolved, it's going to stop your body from healing. You're not going to be able to heal a tendon. So we need to look at these other things, because if you don't address each of those pieces that are causing the symptoms, even if you miss one thing out, it's going to slow it down, or it's going to stop it from healing. And that's really important to fully address everything, obviously. Okay, so treatment is definitely related to the phase that you're in. It also needs to go through certain phases. So what I started to realize after seeing so many clients who had this, everybody was sort of sitting or had to go through these certain phases of treatment. And there are 4 phases of treatment. So the first phase, phase 1, is all about reducing the symptoms, reducing the pain, getting you comfortable, just allowing you to feel a little better, so that we can then move into phase 2, which normalizes soft tissues, brings muscle tension down, regains range of motion if you've lost it, which then allows us to move into phase 3, which is strengthening. Remember I said before that one of the biggest problems is muscle atrophy. We have to increase the strength in the muscles. As we can increase the strength in the muscles, we're going to put a good load through the tendon. That good load helps to heal the tendon. And I'm doing this because we have to, it's called wringing out the tendon is how we heal the tendon, because imagine that rope has been unraveled. We're going to tighten it back up. That's what you do when you heal the tendon. So there's a specific strengthening exercise that heals the tendon, and that's eccentric loading. Concentric loading is going to irritate it. Eccentric loading is going to help heal it. So it's very important to get the right things at the right time, because if you're doing the wrong thing, it's just going to flare it up, and that's going to make you feel worse. Doing the eccentric loading allows you to become pain-free. You get into phase 4, which then we regain function, gets you back to doing everything that you want to do. Now, in each of those phases, we also work on the nervous system, because if you've had pain for longer than 3 months, the nervous system will be involved without a shadow of doubt. So we use these techniques to reverse the biochemical and anatomical changes in the brain, because we have to do that. We have to calm the nervous system down. Often when you're feeling pain, that's sort of your body's harm alarm. It's switched on. You're switched on into fight or flight. You're switched on, your sympathetic nervous system is switched on. That is a survival mechanism that goes back thousands of years. But if we're switched on into survival mode, your body is not going to heal a soft tissue injury like a small tendon in your elbow. It's not going to allow that to happen. So we have to switch off the sympathetic nervous system, switch on the parasympathetic nervous system, which is when the nervous system is calmed. So in each of the 4 phases, even though we're doing specific things to heal the tendon, we're also doing things to calm the nervous system, because that's crucial to do. I'm throwing a lot at you here. I hope this helps. All right, so here are the things that I want you to either start doing, or if you're doing, excellent, you're heading in the right direction. So the first thing is, taking vitamin C. We know that vitamin C is really helpful in collagen synthesis, and tendons are made of collagen. So taking vitamin C can be very, very helpful. We also know that vitamin D plays a part in this also. You've heard me mention collagen. And when I first did my course, and 5 years ago, when I wrote the first book 4 years ago, there was no evidence in the research to show that supplementation could be beneficial in treating tendon injuries. That's different now. This is new research that has come out over the last 3 to 4 years. So making sure that you're getting vitamin C, vitamin D. If you have nerve symptoms, and well, how do you know if you have nerve symptoms? If you have tingling, pins and needles, or numbness, you have nerve symptoms. If you have pain that goes down into your fingers, you have nerve symptoms. Maybe it's going up into your neck. That might be nerve symptoms. Nerve symptoms respond very nicely to vitamin B complex. So it's important to have those. So you can see how maybe a multivitamin could kind of check all these boxes. Collagen, we talked about, the best form of collagen. So tendons are made up of type 1 and type 3 collagen. The best forms of collagen are actually hydrolyzed collagen, which means that the strands are basically broken up into smaller chunks. It's just easier for the body to utilize. So when I send the replay out, I am going to send out I'll send you a link to the type of hydrolyzed collagen that I recommend people to take. And again, so there's timing with regards to when do you take the hydrolyzed collagen? Before you exercise. That's when it's most efficient. We're also going to make sure we're taking in protein, because protein are the building blocks for the healing process. Protein are the building blocks for collagen and the tendon. So we want to make sure we're taking in protein. Now, protein is obviously something that you're going to take in through your diet. And the more and more research is just pointing towards whole foods, plant-based diet being the best option for our bodies. And the reason for that is that animal-based products can trigger low-level chronic inflammation. When we have low-level chronic inflammation in the body is not optimized to heal. You are lengthening the healing process. So everything we pull in is going to optimize your body for the healing process. So whole food, plant-based diet, plenty of protein. So that can be beans, that can be nuts, lots of the leafy greens. Adding in a plant-based protein powder, to smoothies and things like that, that can be very helpful also. So making sure that you're getting all of those things in. Now, hydrolyzed collagen, I said before exercise, protein is going to be after exercise. If you're not taking enough protein in, your body is going to take it from a source in your body, which are the muscles, and that's going to weaken the muscles even more. So it's really important that we're intentional on protein. in all of your meals and snacks. So being intentional with your protein, you're most likely going to be taking enough in. Okay, next thing, heat is your friend. And again, go back to, well, I'm not allowed to take the ibuprofen. Well, let me stick some ice on it. That's probably the first thing that you tried. And again, in the first 3 days, the first 3 weeks, ice can be really helpful. Once you get beyond that, there's really nothing for the ice to work on. Ice works really well at decreasing bleeding, decreasing swelling. When we get past those first 3 weeks, there's really not much of that left. So we switch it to heat because we want to increase the circulation to the area. We want to decrease the muscle tension. Heat can do that really well. And this is not hot, hot, hot. This is just a really nice warmth that feels, very comfortable. We want to get that relaxation. We want to get that decrease in muscle tension, because when you're in pain, the muscles are tight, they pull on the tendon and it hurts. If we can decrease the muscle tension, it doesn't pull on the tendon, it's going to feel a whole lot better. So if you can do the heat on the elbow, also on the forearm, because that is definitely going to be affected. If you're feeling any symptoms in your shoulder, you want to get it on your shoulder as well. If you're feeling any symptoms in your neck, you want to get it on your neck as well, because all of these things can be related. If you are feeling symptoms into your hand, absolutely go for that too. I used to say 2 to 3 times a day. That can be really helpful. Then I had 2 clients totally independently of each other. So one was in the US, one was in the UK, but at the same time, they both heated way more than I told them to. They both got better faster. So that increase in circulation, that decrease in muscle tension, we're normalizing things a whole lot faster. That can really help to kickstart the healing process. And heat, you can see here, it can be a hot water bottle, it can be a heating pad, it can be heating wraps, it can be a hot shower, it can be a sauna, it can be a hot tub, it can be red light therapy, any of these things that can be helpful. Do you need to go out and buy anything special? Like a hot water bottle, hot shower, these are as good as anything. So don't think that you have to go out and buy a red light sauna. You absolutely don't. If you have one, okay, fine. But you don't have, it's not essential for the healing of the tendon. And calming the nervous system. Calming the nervous system is essential if you are in that chronic stage. So if you've had this for longer than 3 months, you have to calm the nervous system to allow your tissues to heal. If you don't, and you stay in that fight or flight, you're really going to struggle to heal. You're never really going to be able to heal the tendon. You're going to feel like you're banging your head against the wall, because it just won't. It's going to be really stubborn. Nothing you try is going to really work very well, and you're just going to kind of bounce from pillar to post. So calming the nervous system is going to make a massive difference. Again, this is, there's more and more research coming out with this now. There's a phenomenon called central sensitization, which is a hypersensitivity of the nervous system. I have seen this in several clients. What it can also do is trigger tendon issues in other places. So again, kind of going back to, I started with tennis elbow, now I have golfer's elbow. Well, now I have it on the other arm, and now I have it in my knees and my feet and my Achilles and wherever. So it seems to predispose to other tendon problems. And my theory for that is that the nervous system is hypersensitized. So it's sending more messages than it should. So it's switching on the muscles more than it should, which is tugging on the tendons more than it should, and then you're predisposed to it. So calming the nervous system is essential. And the way that we do that, there are certain strategies that do that. Relaxation breathing is one of the simplest. Just sitting and focusing in on your breath, slowing your breathing down. This is one of the techniques that we use in the Empowered Relief class. And we do this for 10 minutes as part of the class. I guide you through, and we're just focusing on calming the breathing, just focusing on your breathing, just bring it down, just calming through the breath. And we know that what that does, we know as we decrease our respiratory rate, we know we decrease our heart rate. So as we do that, we know we are calming the body, we're calming different systems of the body. As you're focusing in on the breath, you're calming the brain. So we know we get this calming. They've done functional MRI studies that show that you can make a change in the brain. So okay, let me backtrack a little bit. Research is now looking at areas in the brain that are associated with pain. And what we see is there are changes in the brain, in the areas that control pain in people who have pain, have tennis elbow. And we know that we can reverse those changes within 11 weeks of doing the nerve calming the nervous system, the relaxation breathing, other strategies, you know, that we can add in as well. Change the brain. We see anatomical changes in the brain in 11 weeks. So it can be incredibly quick, but it's essential to do those, because imagine if you don't change those centers in the brain, how is it going to heal? I mean, it's like I say, you go back to like knocking your head against the wall. So it's super, super important to do that. So calming the nervous system, relaxation breathing will do that. Yoga can do that. Meditation can do that. Forest bathing, one of my favorites, can do that. Yoga is dose specific, which means the more you do, the better it works. Meditation, 5 minutes a day, has been shown to be beneficial in aiding these changes in the brain. Forest bathing, as little as a 20-minute hike once a week, has been shown to be beneficial to help make these changes. So there's some of the things that you can start doing and start adding in today. So I hope you've been making notes. You will get a replay. You will get the replay of this so you can watch it back too. But what questions do you guys have? Shockwave therapy. Okay, so shockwave therapy is obviously something that is it's kind of in vogue right now. And if we go to the research is not conclusive as to whether shockwave works or not. There is some research that shows shockwave can be beneficial in Achilles tendon problems and plantar fasciitis, so lower extremity. There is no research that shows that it is beneficial in healing tennis elbow. Now, anecdotally, obviously I've worked with many people who have tried it. And some people get good results in that they get pain relief. And obviously that's important. So some people do get pain relief. What is important to know then is that you can get pain relief. So there are two sides to the coin of healing a tendon. Pain relief is one, healing the tendon is the second side. If you get pain relief, you still then have to go on and heal a tendon. Otherwise, it's just going to come back. Because if you don't heal the pathology of the tendon, if we did an ultrasound scan and the tendon still looked degenerated, it still looked thickened, it was still, you know, unraveled, that tendon's not healed. The pain's going to come back because the pathology is not changed. So we have to heal the tendon. So shockwave, some people have used shockwave and got some pain relief. Some have used it, hasn't made any difference whatsoever. Some have used it, made them feel worse. So we've had the whole spread. What I will say with regards to things like shockwave, things like acupuncture, I mean, basically any kind of electrotherapy modality. If you try it for 3 sessions and it's not made any difference, it's probably not going to work for you. You don't need to sort of sign up for 16 sessions to make sure it works. You know, you're going to know within 3 sessions whether it's working or not. So if it's something that you wanted to try or something that you have tried, absolutely try it. But you'll know within 3 sessions. If it's not made any difference, then it's probably not going to. TheraBand Flex Bar. I don't recommend the TheraBand Flex Bar. Reason being, you got to grip it quite hard for it to work, for you to get the and they're trying to load you eccentrically, and you got to grip it hard to get the twist. The gripping is going to hurt your tennis elbow. And so, again, I've had people who have tried it and they're like, oh, it just made me worse. I'm like, well, yeah, that's the reason. Gripping tends to be the irritating factor. You know, when you're picking up your water bottle, picking up your coffee cup, twisting the TheraBand Flex Bar, the gripping can make it worse. Okay, tennis elbow and collagen, does bone broth help? I have had people who have taken bone broth. Again, I mean, you've got protein in there, you've got collagen in there. the research is showing that animal products are just not, they create that inflammatory response, that chronic systemic low level sort of chronic inflammation. So they're not going to create an inflammation at the elbow, but it's sort of a chronic systemic inflammation. So thank you for bringing this up, by the way. There was a research study done in healthy people who were sitting for a long period of time, and you'll see how this links back together. I'm going off on a bit of a tangent, but so a group of healthy people were asked to sit for 4 hours, and they did blood tests at the beginning, blood tests at the end. Sitting for 4 hours, they saw the inflammatory markers in their blood go up. So healthy people, no pathology, not tennis elbow, nothing, but sitting for 4 hours, inflammatory markers go up. And what they then did, they repeated the study again, bloods at the beginning and the end of the 4 hours, but they got them to do a 3-minute movement break on like at the top of every hour. And what happened there? The inflammatory markers came down. So we know that certain things in our lifestyle increase inflammation and this chronic systemic inflammation. Inactivity does it. Animal products in our food does it. Stress does it. Poor sleep does it. So there are these types of elements that can just create this low-level systemic inflammation in our body. And whilst that doesn't directly lead to inflammation in the elbow, again, you're not optimized. Your body's not optimized for healing because it's trying to deal with this low-level chronic inflammation. So I recommend non-animal product, collagen and protein for that reason. I mean, if you are dead set on, you know, I'm going to eat my meat, I'm going to take my bone broth, that's completely fine. You know, take all your supplements too, plenty of fresh fruits and veggies, you know, get all your antioxidants in, making sure you're sleeping well, making sure you're stress relief, you know, all of those other moving, all of those other things that are going to optimize the body for healing. Great question. Glad you brought that up. Any other questions? Had PRP 5 months ago, slight improvement, but feels like it's gone backwards again. Ongoing physiotherapy, chronic in both elbows, currently with shockwave. So yeah, so PRP kind of sits in that same category. So the research shows that it's not conclusive one way or another, which is why a lot of insurance don't cover it, because the research doesn't show that it absolutely works. I mean, I guess just insurance will probably cover your steroid injections, though, right? Oh, but back to PRP. So there are different types of PRP, and not all PRP is created equally. Again, going back to the fact that we now know that local anesthetic is toxic to tendon cells, you know, kind of don't want local anesthetic in there. I've worked with people who've had PRP, and again, I would say the spread is very similar to the shockwave people. You know, some have felt better, some it didn't make any difference, some actually definitely felt worse, but then they would all come to me for the rehab afterwards anyway. So it's not like you just have the injection and then it's better. You have the injection and then the doc sends you for rehab. So you got to do the rehab anyway. So it's again important to be doing the right things, you know, eccentrically loading the tendons. But again, that's got to be done at the right stage. Is the muscle tension down enough that you're going to be able to tolerate the eccentric loading comfortably and not have it flare you up? So again, if you've had any injections, just, you know, that it's behind you, move forwards with rehab, but know that you absolutely can heal, but you need to be doing the right things at the right time. I hope that answered your question. If it didn't, pop another question in there. Okay, so the pain in my elbows seems to feel like it's in the joint. Is this still tennis elbow? I've been living with this for 20 plus years. Pulling weeds makes it worse, especially if I don't pace myself and take breaks. If it's in the joint, it's not tennis elbow. Can you have tennis elbow and another thing? Absolutely. Occasionally, you know, I will see people who have tennis elbow and have some arthritis in the joint or something else going on with the joint. So it's not, that part is not tennis elbow, but there's just two things going on at the same time. And that can happen. That can happen often. Obviously, both need addressing. because if you have pain in the joint, it's more common to see a decrease in range of motion in that joint than if it is just purely tennis elbow. And if we have a decrease in range of motion in the joint is not happy, that can then prolong the tendon issue. So it's important to address both things so that you can ultimately heal. Hope that answered that question too. Any other questions? Oh, you are so welcome, Vicky. Yes, you absolutely can heal. Full-time hairdresser, you know, I do see quite a number in your profession, so it is very hard to rest. Yeah, you do all your exercises. You don't really want surgery. Oh, you're so welcome. You absolutely can heal without surgery. You really, really can. Let me pop this up. So next steps. If anybody wants to take a next step with me, the next step would be to book a free call with me, because I want to hear your story. I want to make sure that I'm the right person to help you, and that would be a free call with me. So please use the QR code, and you'll go to my calendar, book yourself a free call. We can chat and then see what the next step is, or the next steps from there would be for you. What is going to be the best thing for you to do to heal? I do work with people one-to-one, so that is an option. I have a group program. So there's basically a library of videos that kind of take you from start to finish, and we meet as a group weekly. There are sort of self-contained courses, you know, if you just want to go through that, and as I say, there's also my book, so it's kind of whatever is best for you. But that would be the next step. So if anybody wants to book a free call, please feel free to do that. No change in range of motion, been checked for arthritis, not the problem. Yeah, it could be that there's something else going on with the joint there, whether there's some posterolateral instability, whether there's synovitis, whether there's a bursitis, kind of looking for these different things. But tennis elbow it tends to be very specific. So when I ask somebody, where does it, if you had to put one finger on where it hurts, where would you put your finger? Most people are going to go to the bump on the outside of the elbow. That's where tennis elbow is. If you kind of go in at the front, well, maybe biceps is involved, you know, different elements. And again, it can be common for other tendons around the elbow to be affected as well. So I'm seeing somebody right now who has tennis elbow and biceps tendinopathy on the same elbow. So obviously we have to work on both of those. Some people do have golfers and elbow on the same side. Some people have triceps tendon involvement. So it depends on where the pain is as to exactly what elements you need to add in. I mean, for all tendons, you're going to need to eccentrically load them. But that, again, that needs to be done at the right time so it doesn't irritate. And we tend to just add in, obviously, one at a time. So we're not throwing everything in there. We want to make sure we don't irritate anything else at the same time. So what are the specific exercises for tennis elbow for people who have chronic pain to help resolve the pain, discomfort, and rehab movement and strength? That is a great question. So the specific exercises are eccentric exercises, eccentric loading, and that is, it's basically a strengthening exercise done in a specific way. So you might have heard in the fitness area or the fitness arena, when they talk about negatives, you're doing a part of the movement. So for example, like concentric or like lifting your hand up, that's the muscles shortening. That's going to irritate the tendon. Lowering the hand down, that lengthens the muscle in the tendon. That's eccentric, or sometimes called negatives, like in the fitness world. So that's the loading that helps the tennis elbow. But again, if you just did that, you absolutely can just do that if you're in that subacute phase. If you've not had this for 3 months, the eccentric exercises can be utilized very quickly and very efficiently to resolve the tennis elbow. If you're chronic, there's probably other stuff going on as well. The nervous system is involved. You've got chronic pain brain changes that need addressing. So these other things need to work as well. Because I mean, I've had some people come to me and say, oh, I've done eccentric exercises, didn't work. Well, they're doing it at the wrong time. or they might not have been doing it exactly right, or, you know, that there was some element missing. So they are the specific exercises. They do reduce pain, but then there are a whole load of other strategies that reduce pain as well. We talked about heat. That's often the first thing I give people is to utilize heat. One thing we didn't talk about, cardio exercise. I give all of my new clients cardio exercise because it increases circulation. But the other thing it does, it releases endorphins, which are your body's own natural painkillers. So if we can get some endorphins whizzing around your body, that's going to decrease pain. That's going to allow you to feel better. The other thing that cardio exercise does is it decreases stress hormones. So we get some hormone regulation with the cardio exercise as well. So it's looking at all of these different pieces, making sure that they are all addressed. Great questions, guys. Any other questions? So feel free to book a call with me. I would love, love, love to speak to you specifically about your particular story, your particular issue, and then guide you as to what's going to be the best thing moving forwards for you. You know, not everybody will work with me, and that's completely fine. But if I can guide you to my book or, you know, something along those lines, I would be more than happy to do that. So if there are any last minute questions, please don't hesitate to pop them into the Q&A. And I have really enjoyed this. Like I say, I love diving into the research. It is so, so fascinating for me. And I love then applying it and sharing it so that we get this information out. We can disseminate this information. So you will get the replay of this call. You'll be able to book a free call with me as well. And if you have if any other questions come up, because if you're anything like me, you get off this call and you'll be like, oh wait, I didn't ask her that. Yeah, the book's names. So the book is Tennis Elbow Relief 2.0 is the book. You can find it on Amazon. Get Out of Pain Fast is the other one, and that is more general. So that is, you know, I cover back pain and neck pain and knee pain and ankle pain and shoulder pain. So there's a bit of everything in there. It does not go into as much depth on tennis elbow, obviously, because there's just not space in the book. So for tennis elbow, I would suggest Tennis Elbow Relief 2.0. The course name, so the Comprehensive Elbow Pain Relief Program is my big course, covers everything. Every single element is in there. When I learn new things, it goes into that course. And if I have a patient who needs a new exercise or needs an exercise done in a particular way, I'll then put it into the course because somebody else might need that as well. And you get lifetime access to that. So you have this library of videos. And when I put a new one in, you get that too. Or when I update one, you know, that goes in there as well. I had to update all the nutrition and supplementation information in the course. I think I did that earlier this year. No, I think it was end of last year. So when new stuff comes out, that comes out. And then there's basically a tennis elbow starter kit. That is the short course for people who've had pain for less than 3 months, because they don't need all the nervous system stuff. You know, if you've had pain for less than 3 months, you nip it in the bud. I mean, it's so easy. I mean, it's so easy to get rid of it, and it's so easy to do that, doing the right things. Once it ticks over to 3 months, well, then we're looking at these other brain changes, nervous system, all of those other elements that that needs addressing. You are so welcome. You are so welcome. You are so welcome. You're in subacute. You have to stop playing tennis. You can do whatever you like that doesn't hurt, is basically my recommendation. So if you can play and it doesn't hurt, you absolutely can play. That's no problem. And I have some clients who can play and are fine. Most people need to decrease what they're doing for a short amount of time until it's feeling better, and then they can get back to playing. And the way I sort of explain it is, you know, if you take a little bit of time off now so that you can implement the right strategies, you're going to get yourself to the place where you need to be, decrease the pain, decrease the muscle tension, start to build some strength so that you can tolerate playing, and then you go back and play and you're completely fine. You don't want to, if you're playing and you're feeling it, that's irritating it, and it's going to take longer to resolve. It's going to take longer to settle down because it's just that little niggle each time. Great question. You are so welcome. Get a softer frame racket and stop using poly strings. String low. Yeah, I mean, definitely all of those things have an effect. They really do. Had somebody reach out to me, was it about 3 months ago, who had said that exact thing, just they restrung much lighter and resolved their issues. So yeah, it can be as simple as that if that's what's the aggravating factor. Yeah. Any other questions? Okay, so this has been great. Please feel free to book your free call. I would love to chat with you more on your particular issue. And if any questions do come up, you know, reply back to any of the emails that you get from me. If you're like, oh, I didn't ask her that. Oh, great question. Are there any topical creams, braces that I would recommend? So again, kind of going back to the anti-inflammatory. So the anti-inflammatory gels, we now know can prolong it. They can be good in the initial stages. So this is why it's different. If you've not had pain for very long, and again, I'm kind of saying, you know, the first 3 weeks, anti-inflammatories, yes, that's fine. And that's either, you know, taking the tablets or a topical, completely fine. Once you get past that, we want to stop. Braces in the first 12 weeks have been shown to be helpful. Beyond that, not. The reason I don't recommend braces, so again, that's what the research shows us. The reason I don't recommend braces all the time is that once you put one of those straps on, you know, the forearm strap that goes around your forearm, it doesn't go over the tendon, it goes below, it goes around the forearm. You basically have to put it on as tight as you can without your hand going blue or tingling. And it takes the tension off the tendon and it feels better. The way it takes the tension off the tendon is it's on so tightly, the muscles underneath switch off because something else is doing their job. The muscle's like, oh, we don't have to work. So the muscles switch off, which then doesn't pull on the tendon, which makes it feel better. However, when the muscles switch off, they start to waste. And wasting can happen incredibly quickly. The research shows us within 9 hours, the muscles start to waste. So we see changes of wasting in muscles within 9 hours. So for somebody who is wearing the brace all the time and they feel fine, the muscles are wasting underneath, they're prolonging the length of time it's going to take for this to heal, because ultimately we have to strengthen to decrease the pain, to load the tendon, to heal the tendon. So braces can be really good. And I'll say to somebody, if they're doing something out of the ordinary, like if they were moving house at the weekend, they're going to be lifting boxes, packing boxes. It's just unavoidable. They know they're going to be doing it. Like throw a brace on, get the strap on, allow that to feel comfortable, and you know that's fine. But for somebody to put a brace on so they can go play tennis 4 times a week, that's going to irritate it. It's going to weaken you. That's going to delay your healing. A brace that could potentially be quite helpful is wearing a carpal tunnel night splint. So that is the wrist splint. So it kind of holds you in that kind of slight wrist extension. The wrist is up a little bit and it keeps you there at nighttime. That shortens the muscles. It takes the tension off the tendon. It can feel better. If you can, you know, so if you can tolerate that and it feels comfortable, that can be helpful. The people who don't like the brace, the strap that goes around the forearm, are people who have radial tunnel syndrome. So I didn't really touch on radial tunnel syndrome, but it can be misdiagnosed as tennis elbow. So somebody can think they have tennis elbow when they actually have radial tunnel syndrome. So they put the tennis elbow strap on, it makes them worse. Well, That's not right. Well, because the radial tunnel syndrome affects the radial nerve as it passes through a tunnel, funnily enough. So it's a bit like carpal tunnel. Carpal tunnel syndrome obviously affects the wrist and the hand. Radial tunnel syndrome affects the outside of the elbow. So if somebody thinks they have tennis elbow, they've been diagnosed with tennis elbow, they've been given a strap or they've bought a strap, they put it on, they're squishing their nerve, it makes them feel worse. People going back to, it can be the joint and it can be the tennis elbow. People can have tennis elbow and they can have radial tunnel syndrome at the same time. So this can happen. So again, it's why it's really important to know what's going on, to know exactly what is causing the symptoms, looking at that root cause. So I would recommend for nighttime, the carpal tunnel night splint, if that feels comfortable for you. Again, that you don't put on tight. It's quite loose, but it just holds you in that good position to keep the muscle short, to help take the tension off the tendon. The strap, really only if you're moving house, to be honest, or if you have to work. I once worked with a sushi chef and, chopping sushi all day long. And, he had to work to buy his kids Christmas presents at the time. So it's like, put a strap on, dude. And then, like take it off and he would wear it loosely around his wrist when he wasn't actually using his hand to try and minimize the effects of the weakening. Other kinds of topicals. Some people have had good relief with CBD. Again, this is purely anecdotally. I've had some people who try it, doesn't make any difference, but some people have had good relief with CBD. A topical, honestly, as much as what you're putting on, it could be the massaging effect that you're using on that can be helpful. It can increase the circulation, it can decrease sensitivity, so that can be helpful. So if you could probably, use anything as long as it's not an anti-inflammatory or a local anesthetic. That's probably okay. 9 hours, I know, it's really fast. You used a brace for golfer's elbow and it destroyed my forearm. Oh, it gave you tennis elbow. I'm so sorry. More people need to know the muscle gets switched off. Yeah, it happens like crazy fast. Will your job slow you down from healing? You understand that it's aggravating, but you can't stop working as it's everyday movements too. It's going to prolong it, Vicky, for sure. But again, there are things you can do to mitigate it. If you've got a really busy day, using the heat on breaks, that can be very helpful because it brings the muscle tension down. The reason it hurts and the reason it aggravates it is when you're using the hand, you're using the muscles, it's pulling on the tendon. So every time you're using your hand, the muscles are working, pulls on the tendon. So it's just like this, tug, 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 tug when you're using your hand. So bringing the muscle tension down is going to be very helpful because the more you use the hand, the higher the muscle tension goes. Muscle tension goes up, then you feel pain. So that makes the muscle tension go up even more. And it's just this vicious cycle. So if we can stop that by using heat, that can be very helpful. So I would heat it before you go to work in the morning. Even I have some clients who have plug-in heat wraps that they have in the car when they're driving to work. Heat it when you're at work, just as much as possible. The gold standard for heating is 10 minutes every hour. And it's not forever. It's just in those initial stages to kickstart the healing process. But minimum 5 times a day. So I would be heating the heck out of it. And then, gentle stretching, just soft tissue massage, anything you can do to bring the muscle tension down is going to be helpful. But yeah, it's going to be a challenge when you're constantly using the hand. Alrighty, any other questions? I'm super excited to be meeting some of you on the free calls and really just starting to hear your stories because everybody's story is a little bit different and just figuring out what's going on, it's kind of nice. I kind of like doing that. Yeah, you are so welcome. So book your free call. If any other questions come up, don't hesitate to reach out. You will get the recording of this webinar. You'll also get, my recommendations for the things that you can start doing now. I'm going to put in there what, like the first things that are going to be helpful. So you can start doing those now. And I hope to see you soon. So thank you for joining me today. I really, really appreciate it. As you can tell, I'm a little bit passionate about this. I flipping love this topic. So thank you for joining me and know that it can heal. That's, I think, the biggest takeaway that I want you to get from this. It absolutely can heal. If you do the right things at the right time, you can get back to doing everything you want to do. All right. Hope to see you soon. Take care. Bye.